Hey everyone! Today we're diving into a game-changing discussion on prostate cancer and active surveillance. If you or someone you know is dealing with low-risk prostate cancer, you won't want to miss this. Stick around to find out how MRI is changing the way we approach biopsies and what this means for men considering active surveillance. Before the MRI era, doctors relied on traditional biopsies to assess prostate cancer risk. But here's the problem. 1/3 of men classified as low risk actually had more significant disease that was missed. Why? Because standard biopsies often fail to catch aggressive tumors due to undersampling. That's where MRI comes in. If you've been diagnosed with low-risk prostate cancer, grade group 1, and you're considering active surveillance, your doctor might recommend a confirmatory biopsy, a second biopsy, to double-check your risk. But do you really need it if you've already had an MRI-informed biopsy? Let's break it down. In this study, researchers looked at 522 men with low-risk prostate cancer who got an MRI and a confirmatory biopsy, both targeted and systematic, within 18 months. The goal? See if the second biopsy found more serious cancer. MRI has revolutionized the way we detect clinically significant prostate cancer. It not only helps find aggressive cancer early, but also reduces unnecessary biopsies for men with truly low-risk disease. That's why it's now a guideline-recommended imaging tool for men considering active surveillance. So, what did our study find? We looked at a group of men initially diagnosed with very low-risk prostate cancer. They had an MRI and a confirmatory biopsy, CBX, within 18 months. Here's the shocking part. Men with a positive MRI, PIRADS 3 or higher, still had a high risk of disease progression even after an MRI-guided biopsy. In fact, 27% of these men were upgraded to a more serious cancer diagnosis. And it doesn't stop there. Some of these men were reclassified to higher risk disease, 16% to unfavorable intermediate risk, UIR, and nearly 8% to grade group 3 or higher. So, if you've got a positive MRI, a confirmatory biopsy is still essential. But what about men with a negative MRI? This is where things get interesting. Only 5.5% of men with a negative MRI were upgraded to UIR, and just 2.3% to grade group 3 or higher. With an MRI negative predictive value of 90 to 94%, these men could actually skip confirmatory biopsies and instead wait for a surveillance biopsy in 2 to 3 years. That's a big deal. We also compared men who had an MRI before their initial biopsy to those who had an MRI afterward. Interestingly, MRI timing didn't significantly impact reclassification rates. However, even men with a positive MRI needed both systematic and targeted biopsies. Why? Because skipping systematic biopsy meant missing over 30% of aggressive cancers. That's huge. So, what does this all mean for men on active surveillance? Well, if your MRI is positive, a confirmatory biopsy is still strongly recommended. But if it's negative and done at an expert center, you may be able to hold off on another biopsy for a couple of years, following regular PSA monitoring and MRI scans. This could reduce unnecessary biopsies by 40%. At the end of the day, MRI is changing the game for prostate cancer surveillance. It's helping us better identify who needs urgent follow-up and who can safely wait. This means fewer unnecessary procedures and better peace of mind. If you found this information helpful, hit that like button and subscribe for more updates on cutting-edge prostate cancer research. And let's keep the conversation going. Drop your questions in the comments below. Until next time, stay informed and take charge of your health.